Thanks for joining me this evening. I think it'd probably be quite helpful for us both to introduce ourselves I'm going to be I'm chairing this today. So I'll introduce what we're doing today. I've asked Paul here to help me with a few things I'm facing. I've got into my running recently, as many people do, as many of our patients do, and I'm sure many of yours have, Paul. I'm starting to get to that point where I've been doing it a bit and I'm starting to see some injuries coming through. I'm a non-clinical person, so I'm going to ask the questions from the perspective of a layperson today. And I'm hoping that Paul can help me with his superior expertise. So introduce yourself, Paul. Tell me about your superior expertise and I'll tell you where I'm coming from as well.
I don't know if they're superior, but we've definitely got enough experience. So yeah, no, my name's Paul. I'm a chartered physio. We run 6 clinics scattered across Bedfordshire and Buckinghamshire. But my background's physiotherapy, sports science. I used to work in professional football with a team locally. You've probably heard of them, McDonald's as they call them. So I was there for 4 years, and then we started our own clinics up, and so we treat everyone and anyone really. We don't focus on any one type of injury, and I've been doing it for about, I don't know really, coming up to 10 years I guess. So yeah, no, it's all good, and I'm just in our Newport Pagnell clinic at the moment. Popped in to do this, so yeah, that's me really. I'll help out as I can.
Good. Well, so I come from a non-clinical background. I'm the business development director at Kube Medical. We're a multi-disciplinary musculoskeletal clinic, which is about the shortest way we could come up with of saying we have chiropractors, osteopaths, sports therapists, massage therapists, and we pretty much try and do it all under one roof. So people come to us probably mostly because they don't know where to turn to. They just know they need some help with some pain. So the purpose of these is to understand a bit more about some of the issues that people may be facing and try and give them a bit of info.
Yeah.
So, and my clinical expertise comes from breaking myself in several different ways. I love my sport. I've played rugby, I've rowed, I've done running. I did London Marathon some time ago, which I really should have done because I was about 18.5 stone at the time. Yeah, I break myself. That's what I do. And fortunately, I've gotten myself into a position where I'm surrounded by people who can help me out. So this is where I'm going to tap into your knowledge, Paul. So we talked before this about a few of the ideas of common issues that people might face, and the first of those on our list was sort of knee pain. General knee pain is quite commonly associated with running. So I was hoping you could tell me a bit about the symptoms and how people can help themselves and how you could help people.
No worries. Okay, so yeah, I've actually brought the knee with me today. So I pulled my leg off earlier. Here it is. Yeah, in terms of knee pain with runners, I think we were going to address for anterior knee pain. So it's pain around the front of the knee. So when you're running a lot, you can get pain just around the front. You can also get pain on the inside of the knee or the outside, sorry, the other way around. So the outside of the knee, which is the smaller bone is the fibula. So you can get pain around here, or you could get pain on the inside of the knee. But I think the one that you're referring to, Patrick, is the pain across around the front of the knee.
Yeah, I think most commonly, when I've faced it, it's certainly been around the front of the knee.
Yeah. So when we're thinking about kind of what could be causing the pain, we need to kind of really narrow down on kind of what structures it could be. So I've treated loads of runners recently, and you can get pain on the actual tendon, which is here, which when you press on the patient's tendon, they normally get ouch or feel the pain. Otherwise, you can get a deeper sensation of pain, so you can't quite put your finger on it, and normally that's more associated with the joint underneath, which is called the patellofemoral joint. So the small bone being the patella and the femur, so the patellofemoral joint being in here. And the way that works is it sits in a groove, and as you bend and straighten the kneecap glides through the groove in here and can irritate and cause pain. It can also be it can be present with or without clicking in the knee as well. So some people get a lot of clicking when they're bending their knees, and straightening, but it's important for people to know when to do something about that and when not to. So anterior knee pain, it could be the tendon, it could be underneath the kneecap, it could be the attachment of the tendon to the kneecap, or it could be above the kneecap, attaching into your quadricep muscle, which is a main muscle which straightens your knee and pulls up. So first of all, it's all about identifying what the cause of the pain is and what structure is actually injured, because the knee does, I know it seems quite simple, it bends and straightens, but there's different aspects to the knee and different parts of the knee that can be injured, and it's about knuckling down which part of that's the problem initially. But yeah, the patient might be swollen around the front of the knee, so if you get swelling around the knee, if you get any giving way in the knee is another common question we ask, and clicking and clunking, giving way, and swelling is, and then pain, whether the pain's during the exercise, after the exercise, or the next day, is quite key, really.
So there's an expression here, no pain, no gain, and I'm going to use it for each of these. So there are going to be times when you can push on through things, and there are going to be times when you really ought to stop and pay some attention to it. Can you give any sort of indications as the red flags that might be that should tell you to stop and seek some help or do something to self-manage?
Yeah, well, we've got to make that judgment, don't we? I mean, we can expect when we're running, when we're exercising, to get some discomfort around the knee. I think what the key is to kind of notice kind of how severe the pain is. So we normally gauge it on a scale of 0 to 10. If you're getting pain and discomfort maybe above a 5 or 6, then we're going into the danger zone, really. You know, we shouldn't be having that much pain after exercising. If it's a dull ache, about a 3 or a 4, then it's just a little bit of a sign to say actually something's happening here. And then obviously if you're a 1 or 2 out of 10 discomfort, then you should be okay to carry on. But it's definitely important to monitor that, because you don't want that to then get worse and worse and then need to come and see us. So like I said in previous times, I think you've just got to be able to listen to your body, and the more exercise you do, the more responsive you have to be to that as well. But if it's just a general ache of the muscles, then you can expect that after exercise, and then I would advise a little bit of rest in between. So put a day's rest in between sessions, just to let it settle down again. So listen to your body and then change kind of how regularly you're training if that's becoming a problem. Okay.
So that's a little bit of a self-help there in terms of the building rest into your schedule. Is there anything else that people can be doing from a self-help perspective?
Yeah, so you could, I mean, I think if you're doing a lot of exercise, you should probably have some ice packs in the fridge, in the freezer. So have them ready. Also, I like using heat on different structures. But if you've got an inflamed area, you don't really want to put heat straight on it. But if you've got a tighter muscle, for example, a tight hamstring or a tight calf, providing it's not swollen or torn or strained, using heat on that soft tissue can really help kind of loosen it off and settle it down again. So I'd say have heat, have cold therapy available at home, and then nowadays you've got all the things like the muscle guns. I think we've introduced the muscle gun the other day. So
muscle gun the other day.
A muscle gun, you could get a Theragun on there to look after yourself, or you can also get hold of like foam rollers. So everyone loves a foam roller at the moment. So they buy the foam roller, and it's like, actually, I don't need a physio. I've got my foam roller. You know, we'll survive. So
I don't know. Mine just gathers dust.
Well, Patrick, maybe you need to get it out, mate.
I do. I've lost it. I was looking for it earlier this evening. I've lost it. Over you, clearly.
Yeah, so the foam roller, and then obviously flexibility in between sessions. So when we exercise, our muscles get a little bit tighter when we've used them. So once you've recovered from the session, lengthening your muscles out in between sessions really helps kind of reset the musculoskeletal system. So good flexibility in between, and then maybe even some core exercises in the meantime, some kind of strengthening of the muscle groups around the areas you're working as well. So that could be in the form of kind of a strengthening program at home, or a Pilates class or something like that, or some yoga if you like it. So just something to kind of break up the exercise that you're doing, so you're not overloading the same areas of the body in the same way all the time. So there's some really good little tips, actually, just kind of what you can do to help yourself in a bit more detail.
Brilliant, thank you. So I guess that covers the whole, what if you're around that 5 and you're thinking, I need to manage this myself. If you're pushing up towards that 6, 7, 8 and you're thinking, this is beyond my skills, I need to see a professional. For you as a professional, what would you be looking at for someone with knee pain? What would be your top concerns there?
Yeah, so normally what we'd probably cover is, in the first session, when a patient comes in, finding a bit about the history of the pain or history of the present condition. So how it happened. Did they land off a curb? Did they twist their knee during a football game? How did it occur? So normally you can relate the biomechanics of the injury to that gives you quite a lot of clues as to what could be happening. And we also want to make sure that we haven't got an injury to the deeper ligaments in the knee. There's 2 ligaments here, the ACL and the PCL. So we want to do some tests to rule out some long-term issues as well. And then once we've cleared that up, then we can kind of go into more detail in terms of a physical assessment. So we get the patient on the bed, on the plinth, and undertake a full assessment of the knee. And then we always assess a joint below and above. So we'd look at the ankle and then also the hip. And then we'd also have a look at people's movement in different types of movement. So, for example, if they're getting problems squatting in the gym, then we'd have a look at them squat and seeing if there's any reason to suggest that squat's putting that joint under too much pressure. So there's quite a lot we'd have to go through during the first session. But once we understand what it is, then we can put a treatment plan in place to get the person on the road to recovery again. And then we'd advise a treatment plan going forward to getting them out of the pain and back to full function.
Brilliant, thank you. So had a question crop up on the live while you were talking there about would those muscle guns be good for a roofer's back?
Probably
getting one into your back might be a bit tricky, but I think they're pretty good for most muscular pain, aren't they?
Yeah, you can definitely you can get them on your back. So if you're having problems after a long day's work, so you can just pop it here, and they're quite handy because you can actually hold it onto your upper traps to get to your lower back. Yeah, just got to be careful here, but yeah, it's pretty simple. You can get to different parts of the body with it. No, they are quite good and accessible. If you've got someone else at home that can help you with that, providing you're friends with them and they don't hate you, then you can get them to
getting roughed up too much.
That's yeah. It can definitely help. And we're seeing more and more people in the trades come in for physio now. I think everyone's really more aware of kind of like when they're doing the lifting on the building sites, when they're in the workmen and women, they're more aware that they've got to last a little bit longer in their careers, because otherwise, if they can't move and they have back pain long term, it's definitely going to shorten their careers. So yeah, definitely. I think if you've got a manual job, you should be looking after yourself, and especially as we get a little bit older, our tissues don't heal as well, so we've got to look after them a little bit more. Yeah.
Well, chiropractic and osteopathy come at things from very much a wellness perspective rather than a illness perspective. So we would very much, as a clinic, advocate looking after yourself and coming in and getting seen earlier and looking after yourself to make sure that you continue to function well rather than waiting till you're in real difficulties.
Yeah, I mean, yeah, we like probably you guys, we get people coming in. So if they're say about to go back with the army, the military, or go back to work, or go back to doing exercise again, it's not going to do any harm coming in for one session and getting screened. So we're having a check over, and then talking about what you're going to be doing, because if we know what you're going to be doing, we can prepare that for you before any niggles take place. So yeah, the wellness side of things and the injury prevention is the way forward.
Cool. Okay, so moving on, next one of our issues that we were going to talk about was ankle sprains. And I suppose aside from simply stepping off a curb or doing something silly, these can crop up as part of your running, gait issues, etc. But I'll hand over to you at that point and say, ankle sprains, what are we doing?
What in terms of getting it better, or just
well, in terms of where it comes from and what people need to watch out for.
Yeah. Okay. So I think most of us have had an ankle sprain in our lives. If we've been playing football, or we've been playing netball, hockey, or any twisting and turning sport, it's a very common injury, and this is a foot, an ankle. So I'm glad I got that corrected today, because I was worried about getting muddled up the knee and the foot, but yeah, this is definitely a foot. So basically, an ankle sprain occurs when the foot generally rolls inwards. So your ankle just goes bonk like that, and it gaps this side of the ankle, which has lots of little ligaments here, and that pulls those ligaments, and it causes an acute injury, we call it. So a sprain. So you'd sprain the ligament, and what happens there is you get some micro tears in the ligament. So whereas it used to be nice and strong and full, when you roll your ankle, it tweaks the ligament, causes some micro tears in the ligament or ligaments, and then that causes swelling. The other thing that can happen when you roll your ankle is it turns inwards like this. This doesn't actually move that well, but it rolls that way. Okay, so inversion. And what can happen is you can actually pinch this side of the joint. So quite a lot of the time people have pain on the outside of their ankle, but they also get a little bit of pain on the inside, and that's because it can roll in that much. It pinches these structures and then stretches out the structures on the outside. So initially you're trying to reduce your swelling. So it's rest, ice, compression, elevation, and protection. And then what we're trying to do is get the range of motion back. Yeah. And then once we've done that, then we need to strengthen the muscles that are going to stabilize that ankle. And that normally involves strengthening the perineal muscles, which are down the outside of the ankle, and they pull your foot outwards. So so there's a phased rehab process in terms of getting your ankle back to full stability and re-strengthening that again. One thing I would say, if you do roll your ankle and you can't put weight on your foot, it's generally advised to go to A&E. So if you can put weight on your ankle and you've rolled it, you should be okay. Yeah. By the way, this is not medical advice on here, but
I was going to say, it sounds like a sound piece of advice to me, but
yeah,
carry
it
on.
is. If you can't put weight on it, yeah. So it's just a question you ask yourself: can I put weight on my ankle? If you can't put weight on your ankle, it's A&E. Okay, and then you'd have some scans done and then sent home. But if you can weight bear okay on the ankle, and it just hurts kind of like when you're turning your foot inwards and outwards, you should be okay. And then I'd probably advise going to the physio or the therapist, osteo, chiropractor, whoever's your kind of go-to person. How's that, Patrick? Is that a general overview okay?
I think that's good. I think the one question I'd ask is, what can you do? So if you've established that you're all right, you haven't done anything too serious, and you're not quite at the level where you're going to see a professional about it, is there anything after that rest ice compression, elevation, protection rotor that you can do yourself at home to start yourself on that journey to recovery?
Yeah, it's a bit of a balance between kind of not doing anything and then movement. We know that by not moving the ankle, we're not going to heal as quick. So when you're at home, after a few days, hopefully the swelling settled down a little bit, then it's key to start pumping your ankles. So just forward and back, repetition with no weight going through the foot. So just start pumping your ankle forward and back. And what that's going to help with is pumping any lymph or swelling back out of the ankle. And then when you're doing that, you'd ideally have your foot up, so it drains the swelling from the ankle down up towards the knee. So just gentle movements forward and back, and then just gradually build up your weight bearing, so build your walking up slowly. I'm not a big fan of ankle braces unless they're really, really required. If the ankle's that unstable, then you might have like ruptured the ligament or something like that. So then you would need to investigate a little bit more. But yeah, just start off lifting the ankle up and then pumping your ankle forward and back. And then we could even start with little circles of the ankle just to get some movement through it. And all you're doing is you're doing that as pain allows. So you're just going as far as you feel comfortable to that way, and then all the way down that way, and then all the way back, and repeat. If it gets too painful, that distance, don't go there. Just start building up the range there. So we call it active ranges of movement as pain allows, basically. So that's what you'd start doing. And then if the swelling's really bad, then you need to get the ice on there to help with the swelling, and that can last a while, to be fair, with ankles, because obviously it's right at the bottom of our anatomy. When we're standing up or sitting, you can get that swelling just pull in that area, which creates quite a swollen ankle joint, and it's hard to get the swelling back up against gravity. So sometimes that phase can take a few weeks.
I'm going to throw something a bit random at you now, as a football thing. So I remember a few years ago when Alan Smith, who was a Leeds player, he went to Man United and then properly did his ankle, like foot pointing in the wrong direction type job.
Yeah.
And I remember reading that they thought it wasn't going to be too bad recovery because he'd broken things rather than stretched things. Is there any truth in that? And can you talk me through that a little?
Yeah.
Or is that complete rubbish? Have I made that up?
No, it's fine. It's all about kind of structural healing. But when you've got a big injury like that, so I have actually seen a few of those on the football pitch. So you go on and the foot's kind of facing the other way. It's called a fracture dislocation of the ankle generally. So it's where you've had bones break here and the foot's completely twisted around the other way. You can just get a dislocation, but we can also get fractures with it. When you get a big injury like that, you need to go to hospital. You need to get everything kind of realigned, and it might have to be stabilized first. So you probably end up with some metal work in there as well. But no, I wouldn't suggest that you break your bones if you think you've strained your ankle.
I think we probably strayed a long way away from running injuries here, but that was an interesting ankle thing that I thought I might bring in.
If you fracture a bone and it's realigned, it's going to take 5 to 9 weeks to heal. If you pull a ligament or stretch a ligament, they can take up to 3 months to heal and more. So yeah, that's why that saying comes up. Alan Smith or whoever has one of these injuries, they're going to have a combination of bony injury and then ligament injury as well. And then quite often, because they've been out of the action for so long, the immobility, so they haven't been using that part of the body, that then causes problems as well. So So getting back away from the horror show injury, if you've experienced an ankle injury while running, it's probably going to take some time to get back on top of it. So don't rush back. Yeah, definitely. With an ankle sprain, you're probably looking at about 9 weeks, 6 to 9 weeks to get back to full function again. But again, you can have degrees of strain. So you can have a kind of grade 1 strain, a grade 2 strain, and so on. And sometimes you can just roll it and tweak it. So like, for example, I actually rolled my ankle years ago playing football, and even when I run now, I rolled it the other week doing a run. I came off the curb funny, but luckily it hurt at the time, but it went within kind of four days. So you managed it. So it wasn't like a large tear. It was a lower grade injury. So even going and get the diagnosis, you kind of puts you at ease and understanding kind of how bad that injury is. But yeah, worst case scenario, you've ruptured the ligament, which means a complete tear, and then you'll get full range without pain. Because if you tear the ligament and it's completely detached, the nerves are kind of shot, so you can get full range. And you're like, oh, actually, it doesn't hurt too much, and that's because the ligament's torn completely. So
but then you probably see quite a lot of swelling and so on. That'd be other indicators that there's something amiss.
So straight away, it probably balloon up straight away. So yeah.
Okay. Good. Yeah. Well, let's move on from Alan Smith, football injuries, horror injuries of feet pointing the wrong way, because that's not what we're going for. We're talking about I do worry about doing that on the far end of a long run sometimes and struggling to get home. But the other one I wanted to talk about was hip pain. Now, this is something dear to my heart, because recently my hip's been giving me jip while running. And it's been a challenging one, because it starts off dull and then gets fairly uncomfortable along the way, and this was part of the reason why I wanted to have this conversation in the first place. So what can you tell me about hip pain?
Yeah, well, there's lots of different types of hip pain. I think, but I know Sam, so she had a little look at your hips as well, and she said, and so there's loads of different types of hip pain, and depending on where the pain is again in your hip, it could be a different structure that's injured. But I think for the purpose of this, we'll talk about kind of lateral hip pain. So it's pain on the outside of the hip, so out here. So if you're running and you're getting pain in this region, it could be that it's the hip bursa, but it could also be a gluteal tendinopathy, or I know you talked about the TFL earlier, which is one of the muscles which stabilise the IT band.
There's a lot going on in there.
There's a lot going on, and there's a lot of structures around the hip. The hip's a large joint, so you need to kind of find out again which structure it is that's causing the problem. So quite commonly with running, it's the IT band rubbing across the hip bone at the top, or it could be irritation with the bursa. So a bursa is like a little sack of fluid, but all the muscles run across it, and ligaments and tendons, and then that inflames gradually over time, and then that can become painful in the hip. So so if that's the case, it's all about finding out what's causing the pain. But then there's normally some associated weakness which causes that person to have that problem. So it's getting rid of the hip pain to start with, and then finding out kind of why they were getting it in the first place. And that could be anything from glute weakness, lack of flexibility in the hips, or if there's a kind of an unbalanced hip positioning going on, or even a pelvic tilt forward or back. So once you've got the hip settled down, it's about finding out the why, and that's where we'd kind of get the patient on the treadmill, have a look at them move, and see if their knees are dropping in, if their glutes are weaker on one side, and then we'd lengthen the structures around the hip, and then strengthen the structures around the hip. So again, there's loads of different types of hip pain, and if it's referring into the groin, then it could be that it's a more deeper issue. It could be the hip itself. So there's so many structures that could be injured, and it's kind of figuring out which one it is.
So what can people do for themselves, not knowing what the cause of the hip pain is, not knowing what the issue is? What can they do for themselves, and to what point do they push on through, and when should they be taking action?
Yeah, I mean, you've got to be careful, obviously, going on Google all the time, because if you put in a keyword, it's going to come up with loads of suggestions anyway. You can kind of have an uneducated guess or an educated guess of kind of what the problem is, and have a look online for some advice. You know, it's no harm doing that. You know, and if a lot of patients do that, but I'd probably say, look, if you try and self-treat it for a while and then you hit a wall, then I'd give the physios a buzz. So again, same things apply. Maybe some light stretching of the glute muscles, and then some strengthening of the glutes as well. It's very common. But then we also have to look at your hamstrings and your hip flexors to see kind of how they are as well. And a lot of that is looking at tests on the plinth. So we'll get the patient on the bed and we'd assess kind of what movements that patients can't do with their hips and what movements they can do. And then it's a movement screening process again.
So it sounds like it's something that I think anyone who does any serious amount of sport probably knows, which is a decent warm-up and a decent stretch and cool down at the end is going to help prevent and manage those injuries in advance. But yeah, if you can carry on going, then you're okay if you're not in too much pain.
Yeah, definitely. But ideally, you don't want to get stuck in pain. If you're doing an exercise like running, you know how far you can get, so don't overexert yourself. If you do get some pain in the hip, then obviously next run or exercise, I'd probably drop the duration of the exercise, and then maybe also add in some rest time in between. Otherwise, it's just going to keep aggravating and get worse and worse. Yeah, obviously don't run through hip pain. Like if you're getting pain in the hip, there must be a reason. You could try some self-help at home, like with the muscle gun, the foam roller. You can also use spiky balls as well to get into your hip. So you could do some self-release work with these. They come in different forms.
They're like a foam roller, but much more targeted.
Yeah, targeted. So you'd get into a hip stretch with your foot across your body. We call it a figure of four stretch, and you can just use these to work out kind of tight areas. So self care is definitely it's becoming more and more common. So don't run through it. Don't run through it and make it worse. And the only other thing is, don't get frustrated with it. So if you get a bit of a niggle and you've started something new and you're increasing the volume and you've been doing it for a number of weeks now, don't get frustrated because you've actually improved quite a lot. But you can find is that you start something new, you get so far, you're going really, really well. And then when you start increasing your speed, the amount you're lifting, the depth of your squats, blah, 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 then different structures start getting loaded. And all of a sudden, boom, you get an injury. So don't get frustrated with it. It's actually that you're increasing your loading, the amount you're loading, the weight you're lifting, and the distance you're traveling. So then that has to be managed.
Cool. Wonderful. Well, that's everything that I had on my list. I'd just like to say thanks very much for a load of really interesting information, and certainly something that I'll take on board and start considering. I think I may need to do a little bit less running, a little bit more working on my hip at the moment, but
get your mobility back.
Get my mobility back and get back to it. But really appreciate everything you've taught me through this evening, and thanks for all the great information.
No worries, Patrick. Thanks for having me. And we could probably do this again with some other injuries as well going forward.
Wonderful. Looking forward to it. All the best, Paul. Take care.
Cheers. Thank you very much.
Bye.
Bye.